Nutritional needs of infants and children, breastfeeding, supplementary or artificial feeding, and weaning. Good nutrition is essential for maintaining life. The objectives of good nutrition for children are to promote optimal growth and development, to prevent nutritional deficiency states, to help prevent acute and chronic illnesses, and to provide reserves for stress. Nutritional needs can be met in the human being through nutrients provided by the way of GI tract or through parental feedings. Human milk provides all the nutritional substances infants need over a period of time, but no other single food meets all the essential requirements for human being. A varied diet must be eaten after 5 to 6 months of age, and it must include water, calories, proteins, carbohydrates, fats, vitamins, and minerals. Breastfeeding is the best natural feeding, and breast milk is the best milk. UNICEF states that every year over 1 million infants die and millions of others are impaired because they are not adequately breastfed. Every day between 3,000 to 4,000 infants die from diarrhea and ARI because the ability to feed them adequately has been taken away from the mothers. Breastfeeding. Breastfeeding is the feeding of an infant or young children with breast milk directly from female human breast via lactation rather than using infant formula from a baby bottle or container. Babies have sucking reflex that enables them to suck and swallow milk. Experts commend that children be breastfed within 1 hour of birth, exclusively breastfeed for the first 6 months and then extended until 2 years of age. Types of breast milk. Types of breast milk varies at different stages in the postnatal period to fulfill the needs of the baby. First one, colostrum. It is secreted during first 3 to 4 days after delivery. It is thick, yellow colored, small in quantity, contains more antibodies, WBC, proteins, and fat soluble vitamins, alkaline in nature. Then transitional milk. Transitional milk follows the colostrum and secretes during the next 2 weeks of postnatal period. This milk is increased in quantity and changes appearance. Immunoglobulin and protein content decreases, fat and sugar content increases. Then form milk. Form milk is secreted at the starting of the regular breastfeeding, and it is more watery to satisfy the baby's thirst, contain more proteins, sugar, that means lactose, vitamins and minerals, little fat and calories, color is white or in clear color. Next, hind milk. Hind milk is received at the end of the breastfeeding session. It contains more fat and calories, color in white or in cream. Quantity is less comparing to form milk. Mature milk. Mature milk is follow the transitional milk and secreted usually from 10 to 12 days after delivery. This is a mixture of both fore and hind milk. This milk is watery looking and more thinner, contains all nutrients for optimal growth of the baby. Color is pale like and can look creamer as the breast empties. Then preterm milk. The milk is secreted by the mother who has delivered a preterm baby is different from milk of a mother who delivered full-term baby. It contains more proteins, minerals like sodium, iron and calcium, immunoglobulins which is appropriate for the requirements of the preterm neonates. Composition of breast milk: water, protein, carbohydrate or lactose, various fats, antibodies, vitamin and minerals, human milk, oligosaccharides, 800 strains of bacteria, other immune cells and hormones. Breast milk composition per 100 ml: carbohydrate 7.2 grams, fat 4.1 gram, protein 1.3 gram, prebiotic oligosaccharides 0.7 to 1.2 gram, others 0.2 grams, and vitamin and minerals 0.17 gram. Advantages of breast milk. Breast milk is often referred to as liquid gold. It has all the essential nutrients for a baby and is easily digestible for them. First one, provides optimal nutrition for the baby. Human milk contains the right nutrients in the right amount for the baby. The nutrient compositions even changes to meet the changing needs for the baby over the course of feeding, the day, then the infant's lifespan. Then high water and electrolyte level. Water content is 88% in breast milk with low osmolality, which lowers the solute load to kidney. And breast milk protein is easily digestible. It is also contains amino acids like taurine and cysteine, which is necessary for neurotransmission and neuromodulation. Help in brain development. Fat in human milk is rich in polyunsaturated fats in myelination, promotes healthy weight gain, reduces the risk for allergies, lower the risk of getting obesity, heart diseases, tooth decay, asthma and urinary infections. Strong immune system. Human milk contains maternal antibodies that are passed from mother to baby. They help to weaken or destroy harmful bacteria, help to generate antibodies and promote growth of friendly bacteria in the infant gut. Reduces the risk of various infections. The common are middle ear infection, eczema, RTI, cold and cough. Mental growth. Breastfeed babies are better bonded to their mother and have higher IQ, and mental development is also increased. And it is cheap or economical, no need of preparation, reduced nutritional deficiency disorders. Complementary feeding. Breastfeeding alone is not adequate and sufficient to maintain optimum growth and development of infant from 6 months onwards. There it is necessary to introduce more concentrated energy yield food by this age. Infant also required iron containing food supplements after his age to prevent iron deficiency anemia. Weaning means to free from a habit. Complementary feeding. The systematic process of introduction of suitable food at right time in addition to mother's milk in order to provide needed nutrients to the baby. Or it is the process of gradual and the progressive transfer of the baby from breastfeeding to the usual family diet. Weaning foods are given in addition of breastfeed when the amount of breastfeeding is inadequate. Prerequisites. Liquid at starting. The semi-solid and solid food to be introduced gradually. Clean, fresh and hygienic food. Easy to prepare at home with the available food stuff and not too costly. Easy digestible, acceptable, high in energy density and low in viscosity and contains all the necessary nutrients. Based on cultural practice and traditional beliefs. Well balanced, nourishing and suitable for the infant. Essential follow sequence. Breastfeed is 0 to 6 month, semi-liquid after 5 to 6 month. It is easy to digest, smooth and gently on baby stomach. Then semi-solid after 8 to 9 month, baby now need food with taste and texture. Semi-solid after 10 month, now baby need food that satisfy his urge and chew complex food. Solid diet 1 to 1.2 years including variety of food item. Complementary feeding at different age 4 to 6 month, initiate with fruit juices, that is clear juices, milk and soup can be given. Rice cereals, mashed carrot, mashed broccoli, mashed pumpkin. 7 to 9 months. After 8 months, you may introduce soft, lumpy food that requires some form of chewing. Avoid foods that can cause choking, walnuts, raisins, and corn kernels. Choose scrapped or mashed foods. Egg yolk can be given from 6 to 7 months onwards. 7 to 9 months, baby biscuits, baby puff, diced banana, diced papaya, diced avocado, carrot sticks, cheese sticks. 10 to 12 months, serve roughly chopped and minced dishes as she shouldn't be eating bland food anymore. Have your child eat what the family eats as long as the dishes aren't seasoned or have excessive sugar and salt. No need to mash but should be cooked well and soft. Barley, wheat and milled cereals, pasta pieces, toast, chapati, rice, yogurt, minced chicken, mashed food, hard boiled eggs. These are the nutritional need for infants. Thank you.